Hello. Now, I thought it might be useful to give an update on the coronavirus, as we've just had the news that a GP connected with Worthing Hospital has just tested positive for the virus. I've just had a very useful update from Marion Griffiths, the Chief Executive of Worthing Hospital and the head of the Clinical Commissioning Group, and they're working around the clock and intensively to minimise any risk to staff and to patients from the hospital. Essentially what has happened is you'll have seen in the news that a businessman from Singapore stayed at a skiing chalet in France, and it so happens that at that chalet were a number of GPs from the Brighton area. One of those GPs worked a shift at the Accident Emergency Department at Worthing last week, and that is the connection. Now, as a precaution, the hospital have sent home for self-isolation a number of their staff from various departments of the hospital. They are being monitored by Public Health England, tested on a daily basis. Of course, they have to be in quarantine effectively for 14 days, and this virus can take at least 11 days before it shows any symptoms. So it's not clear if any further members of staff will actually be tested positive with that virus. Now, what that means is obviously the hospital is short of staff, incredibly, even with the numbers that they've had to send home. Behind the A&E department, all the rest of the hospital is working just about as normal. There are pressures on A&E. So I think my request to everybody is there's no need to panic at all, just be sensible, take all the precautions that have been advised by the Department for Health anyway. And if there's anything you can do to relieve the pressures on Worthing Hospital, that would be helpful. So only use A&E if it's absolutely essential. And obviously there's likely to be some disruption to operations and others going forward. But I have to say, as you would expect, Worthing Hospital is doing an impressive, fantastic job of trying to minimise the disruption, but absolutely with everybody's safety at heart, to minimise the risks to staff and patients. I will give further updates as I get them, but I'm very confident that the situation is being really well handled by our excellent staff at Worthing Hospital and at the Clinical Commissioning Group.